October is Breast Cancer Awareness Month, and a shocking new report shows Connecticut has the second highest incidence of breast cancer in the nation. The Connecticut affiliate of Susan G. Komen for the Cure released the report yesterday at the state capitol, and the study includes a surprising finding: high rates of late-stage breast cancer in several high-income suburban towns. Yesterday's event was hosted by Lieutenant Governor Nancy Wyman, who is pushing for women to get screened before they turn 40.
These are not people that just have parents or mothers or grandmothers that have breast cancer. These are people that never had experience in their family at all.
It's chilling when you think about it, that a state with less than 4 million people would have the second highest incidence of breast cancer diagnosis in the country.
Now, to read the full report, you can go to comenct.org. And this morning, I'm joined by Dr. DrRubino from Hartford County Medical Association to talk more about breast cancer prevention and treatment. Thanks so much for being with us. Now, when we're talking about breast cancer, the thing that is always pretty much being hammered home is early prevention, early detection.
I think that that's one of the key things to keep in mind, that we have made great strides in breast cancer from the 70s, where people's survival went from 75% to now, which is the 90% of people who are diagnosed with breast cancer are living 5 years, and some stage 1 and stage 0 disease are 100% survivals for 5 years.
Now, what some people may not know is there are actually different types of breast cancer.
That's right.
Talk about that a little bit.
I tell people that breast cancer is like a vegetable garden. Not everything that grows out of it is carrots. So it's all different types. There's all different risk factors to the types that there are, depending on what your family history is and when it was diagnosed.
Now, there have been different studies that have come out as far as when women should get their first mammogram. It was 40, it's 30.
Right.
Some people are, doctors are saying do it in your 20s as well. What would you suggest?
I think that the problem with mammograms is that it is a test that shows breast tissue in older women very well. It does not show breast tissue in younger women, and especially women who have dense breast tissue. So if you're going to have a mammogram done early, augmenting it with an ultrasound is the best way to use that test. So we're happy to be able to use the mammogram as long as it's beneficial, but white on white, which is a mass and dense breast tissue of a 20-year-old, doesn't really help us, whereas an ultrasound would be wonderful.
And recently, a lot of the experts have been saying if you have breast cancer in your family or ovarian, check for the BRCA1 or 2. Get tested.
That's right.
To find out if you have that gene.
That's right.
I know a lot of people have, and they found out they were carriers, and they got treatment and find out getting tested essentially saved their lives.
Yes. Early detection is a very important part of breast cancer. We can make enormous impact on what happens to patients. We can get them through surgeries and everything else, but the thing that we want to do is try and get it before you ever have it. And that's what BRCA1 and 2 will do.
So definitely get tested if you have that family
That's
history.
Right.
Now, something we don't hear a lot about, it's not talked about as much, but breast cancer among men.
Yes. Only 1% of breast cancers are male-derived, but there is a risk. It's usually diagnosed much later in a stage because people don't realize that men can get breast cancer.
Right.
But they have the same survival numbers and statistics as women as long as they are matched.
And is that something where if there's breast cancer in a history of breast cancer in the family, then maybe men should be more aware of that?
Absolutely.
And to get checked. All right, thanks so much for
joining
us.
Yes.
And be sure to head to our website, ctnow.com/breast cancer, and there you'll find much more on Breast Cancer Awareness Month, including information on new treatments and diagnostic technology. You'll also find a photo gallery of breast cancer survivors. Prolific?
Well, we have some